June 25th, 2009. Michael Jackson, the king of pop, dies at the age of 50. I think that's a day that we will all remember in our history. Recently in the news, you could not turn on the television, see the front of a magazine or a newspaper without seeing the face of this man, Dr. Conrad Murray, who was held responsible for the death of Michael Jackson. Today I'd like to give you some information about Dr. Murray, speak to you about the drug propofol, which is what actually killed Michael, and talk to you about his trial. According to biography.com, Dr. Conrad Murray was born in Granada in 1953. He moved to the United States in 1980 and went to school to become a physician and a cardiologist. In 1999, he moved to Las Vegas and opened a private practice. And it is here that he met Michael Jackson. Michael was on vacation there with his children when one of the kids became sick. So Michael took the children to see Dr. Murray, and they soon struck up a friendship which led to a professional relationship. Dr. Murray was then hired to be Michael's private physician, and he moved to Los Angeles. It is said that Dr. Murray would have made $150,000 a month had Michael lived and continued on with his comeback tour, because Dr. Murray was to travel with him and be his private physician. But in the meantime, Dr. Murray made nightly visits to Michael's house to administer the drug propofol to help Michael sleep. Michael used to call this his milk, and I can see why. It's very white and milky looking. So on June 25th, 2009, the fateful day, Dr. Murray went to Michael's house after rehearsal, started his IV drip of propofol, and also gave him 2 other drugs. And all this drug information can be found at medicine.net. The other drugs were lorazepam, which is an anti-anxiety medication, and midazolam, which is a muscle relaxer. And we all know what happened next. At 2:26 that afternoon, Michael was pronounced dead. He died of cardiac arrest. According to FoxNews.com and a reporter named Lee Ross, on November 7th, 2011, Dr. Murray was accused of involuntary manslaughter and held responsible for the death of Michael Jackson. Gross negligence was reported in his practicing of medicine. There is in no way should propofol be administered in a house via IV drip. This drug is very, very dangerous and should not have been given to Michael. Dr. Murray also lost his California physician's license. Propofol is a sedative hypnotic drug which is given via IV drip to patients who are going into surgery. It's an anesthesia. Propofol is also known as Diprivan. Propofol can cause respiratory depression and, again, therefore should never be given outside of a hospital setting where there's emergency paraphernalia and people ready to help you resuscitate should you go into respiratory arrest or cardiac arrest, which is what happened to Michael. So just to recount, Dr. Murray was charged with the death of Michael Jackson on November 7th, 2011, and is awaiting his sentencing in Los Angeles. Dr. Murray may face some jail time. We are not sure what sentence he will receive yet, but he was found guilty of involuntary manslaughter in the death of Michael Jackson. due to the drug propofol.